I'm Dr. Craig Escudé, the host of IDD Health Matters, a podcast where we talk about health, wellness, and health equity for people with intellectual and developmental disabilities. Hope you enjoy it.
The IDD Health Matters podcast is a joint production between Friends for Life and Intellect Ability. For more information, go down into the show notes and click the link where it says Learn More Here.
Welcome to this episode of IDD Health Matters. We're coming to you from the NASDDDS conference here in Portland, Oregon this year. And our guest today is John Dickerson. Welcome, John.
Well, thanks for having me, Craig.
So, John, you've done a lot in the field of supports and services for people with intellectual and developmental disabilities. Tell us a little bit about some of the things that you've done.
Well, that's a nice way of saying you're old. So take that. And I was really fortunate. It was 1973. I went to a small college in South Dakota, Huron College. My goal was to be a high school social studies teacher and coach football. I went to college to play football. And I often look back, and when you look at your life and how you make decisions sometime, I had two colleges that offered me football scholarships. One, I'd had to pay $500 to go to Jamestown University in North Dakota and Huron College. I chose Huron College because it's going to be free. $500 to go to school. I mean, that's nothing today. That doesn't even buy books.
Right.
But it was there I met one of my assistant coaches who was one of the first special education professors in South Dakota. Remember in 1973,
That really wasn't a popular thing. Yeah.
Mandatory special education didn't start until 75. So he came up to me one day and said, "Have you found a teaching job yet?" And I said, "No." And he said, "Well, I'm on the board of this group called the ARC, and they're trying to help people with disabilities. And why don't you go talk to them? They need somebody." And they said, "You'll work long hours, you'll go to more meetings than you ever thought possible, and you won't get paid much." All of those were true. And yet it started me on a career, that one conversation that lasted now, I'm starting my 5th decade working in the field. And it started with this informal connection that I probably wouldn't have had in North Dakota.
You never know the little things that will make a difference in our lives.
Oh, absolutely. Yeah. And, the interesting thing about this field is that, as I got on, I had lots of wonderful mentors. And this one mom said two things to me that stay with me today. A delightful lady in Texas. And she said, if it's comfortable, it's not advocacy.
Yeah. Good advice.
And so if you're working with government or with the legislature, if things are going too easy, it means you're not asking enough. You're not pushing enough. And the second thing she said is, you will meet some of the most amazing people in the world, and they will be working every day to get up and make the world better. And both of those were true. And, that's where I've been extremely fortunate to meet people like you that are committed to an area that gets overlooked. We put so much into the areas of work and where you're going to live, but not nearly enough into keeping people healthy. And how you are changing that direction is incredible, because I was talking to Self-Advocate this morning. I happened to be sitting at the table with one of the chairmen of the Self-Advocate board here in Oregon, and his girlfriend had something, not a surprise to you, terrible dental care.
Sure. That's all too common.
All of her teeth were pulled out.
Yeah.
She's been waiting 2 years for dentures.
Wow. 2 years.
2 years. And, he was saying he's worried she's losing weight, and all this is waiting for this to happen. So we have a lot of work to do.
We certainly do. We certainly do. Speaking of work and doing work, you have an organization or a company called Quillo.
Yes.
Right? Tell us what Quillo is.
Well, I had this wonderful career for 40 plus years in the ARC, and lost my mind for a year, cut my hair, and ran for public office in Indiana. As a liberal Democrat running in Indiana, it was an interesting experience. It totally just convinced me of the American people are really incredible folks. We listen to the extremes on both sides, but
it's great to hear that, though.
The average American wants people to work together and achieve change.
Yep.
So it really reinforced my view of the American people. I also had a PhD in campaign financing, how much money has to be raised. But then didn't turn out the way I wanted, but probably turned out the way it was supposed to. And I was challenged by some friends of mine to think about how do we engage families, individuals with disabilities, and staff in a totally different way? We hear a lot about wages. We need to raise wages for DSPs.
Sure.
But Amy Hewitt's work says wages is third on the list about why people quit. Number one is, how do we get along with, you're my supervisor. That's number one. I'm pissed off at my supervisor. I quit. Number two is all the paperwork and compliance things that they have to do. And third was pay. Nowhere in there did it talk about how do we convince people about the why of what they're doing, the value of what they're doing, what it means. And so we did a lot of research. We were looking at this. And how do we attack this? Because I'd lobbied for years about raising money and wages and getting more people services. And we talked to a lot of families. And we asked families, what's the last communication you remember receiving from the state of Indiana, the state of Tennessee, the state of New York? And they said, well, it's a letter. And it's usually about getting requalified.
Filling out more paperwork.
A meeting I had to go to, or my budget's going to get reduced.
Right.
That's what their perception was. And I'm talking to state leaders, and I'm saying, okay, what are your big successes? Indiana, we went from a 14-year waiting list now to it's about 18 months to get services.
It's big.
We don't sell that.
Yeah.
We don't talk about the number of people getting jobs. We talk about the number of people still in shelter workshops. Or we talk about the people on the waiting list. We don't talk about the success that somebody's had. So we created Quillo. It's a company based on microlearning, that the idea of short, repetitive messages that people can look up and find out information that they may not find otherwise. We're deeply honored that we have authors from around the country, yourself included.
That was an honor to be asked, I have to say.
Some of our most popular ones where you explain things to the staff as well as to individuals with disabilities. When, this is funny, I haven't had a chance to tell you this. One of our most watched ones is the one you did on GERD.
Really?
That people wanted to.
Gastroesophageal reflux disease, GERD.
Yeah. And it's like, all of a sudden, this makes sense. That for folks as we looked at this. So
wow, that's heartwarming. Thank you for sharing that.
Well, the idea that short videos, repetitive, that we as adults we have to learn things a lot of times, and we have to hear it a lot of times before we have confidence to try something. So like remote supports, I want to use technology. I want to hear from you as a dad. How did it work for your son? Or I want to hear from the guy that went from having 24-hour staff to now he's at home at night with remote supports, and he likes it. And here's why he likes it. So Quillo provides this technology that is based on charting the life course domains, so people can look up by age or a topic they're interested in. We now have over 2,200 videos in our library.
Wow.
And our customers have added another 2,500 where they can share videos unique to their state of what they're doing. And people can look, Shelley Reynolds calls it the Pinterest of the disability movement. So you can look up a topic, and we've had people say, we want to put recipes on there that we could share within our community of here's how you eat healthier. And one of my goals is to help. We have a couple of young people. We want to encourage them to start a YouTube cooking show.
Yeah, that sounds
how do you eat more healthy? And so Quillo is designed to change the way state agencies and MCOs communicate with folks. And we've partnered with LCO, Life Course Online, about how do you then build a plan that's really yours. Not something you look at once a year and put in a file, but how do you have an organic living plan to be healthier?
Sure.
And how do you turn that discussion into what you want in your life, you don't want, into a plan that makes sense for you?
So, John, if someone wants to learn more about Quillo or access it, how does that work? How do you do that?
It's really easy. They can go to our website. It's just myquillo.com. And there's
myquillo.com.
Correct.
Right.
And there's a little, send me information and we'll get to you on that. So it's really easy. And our whole goal is that it's free for families. And so that's why we're approaching states and saying we can make this available really economically to folks.
Yeah. As much as we want everything to be free, it does cost money to actually make things happen and work. And so
it does.
Yeah.
And, the thing is, when we keep getting ideas from people of how do we communicate about things. So we love listening to our users. And so this group of individuals at the time, some family members and some staff, said this whole issue of early onset dementia, what should we be doing about this? because we're not really trained on what to do.
Right.
And we found this wonderful doctor of occupational therapy in Texas, Laura Golden. She's absolutely amazing. And her almost entire practice is, as an OT, is training people how to work with people who are having early onset of dementia who have IDD. And so she did some videos with us about, your role is not to correct them.
No.
Your role is to make them comfortable.
Yep.
And so if somebody comes to you and says, Craig, I had lunch with the Pope today. Your answer isn't, no, you didn't, Fred. It was, how was it? Now let's talk about what we want to have for lunch tomorrow.
That is one of the best pieces of advice, and one of the things that I talk about is it's not, you don't go in and say, oh, that's ridiculous. That didn't happen or whatever. It's like, okay, well, tell me about lunch. What did you have to eat? And you go on with it. And just
What
like
was
you said,
like?
you kind of,
Yes.
yeah. And like, I guess, like you said, make them comfortable. If you want to start an argument, you disagree with whatever a person with dementia says, and they're going to probably argue with you that it's
Absolutely.
different or true. Yeah.
She had a great thing. I can borrow your hand for a second.
Yeah,
We're on
sure.
video here.
So what do we do?
So she said, you're working with a person that has dementia. In the past, you may have grabbed their hand and moved them. And she said, that's controlling. Nobody likes that.
Sure.
She said, instead, put your hand underneath them and guide them.
How nice.
And
Little
she said,
things like
it changes the whole dynamic. Anybody, I don't care if you have an 8th grade, 12th grade, or a PhD, you can understand that. I shared that story with a school superintendent. He said, that's not true just for people with dementia who have intellectual disabilities. I got to teach my own teachers about that. Because first of all, if you're putting your hands on a kid, number one, you got to be careful.
Sure.
But the idea that she said, it said, so if they're forgetting which room is the bathroom, that's a pretty important thing.
Right.
So she said, pick a color that they like. Blue. Paint the door frame to the bathroom bright blue. They all look the same. They're usually white, right?
Yeah.
Paint it bright blue. It said works every time. But the only people that don't like it? The maintenance people in the home. No. So the idea with Quillo is, how do we inspire, educate, and show something different? Because families and individuals don't know what they don't know.
And you're doing this in, like you said, kind of small little micro-learning episodes, little tidbits, little things that give you a take-home message right there, where a person can say, I can digest that and I can implement that right now.
And thinking about it.
Yeah.
So we take a complex topic like supported decision-making, and which I'm a huge fan of.
Yep.
But if we say to somebody that's already had a guardianship for their son because everybody's told them for 33 years.
That's what they should do.
Been too. Then, so you don't want to first say to him, you made a wrong choice. First say, hey, here's another way of helping somebody make choices. And with Quillo Connect, people can also create a circle of friends. And so we have people now creating their supported decision-making circle, where videos that they create personally only go to their circle. So imagine somebody comes home from the doctor and they say, I just learned that I have, this is a real case. So this is a man who's 54 years old, a friend of mine, and he called me up and he said, I've just learned I've got cancer. And I said, wow, that's hard to take. But what did they tell you? And he ended up he'd gone to the doctor alone, and no, his parents are dead. And so he called me and we're talking about this. And he said, well, it happened to be prostate cancer. And I said, good news. It looks like they caught it early. I have a lot of friends I can introduce you through, been through this. They're 75 years old and, there's good news here. And he said, yeah, but they told me I can either do surgery or I can do these, he called them pellets.
Yep.
And he said, it's up to me.
Or that, or this or that, and I'm supposed to figure this out.
He said, I don't know what to do. And I said, well, let's get a folks together and let's talk it through. And, both are good choices. So first of all, they're not going to give you a bad choice. So it's just which one you want to do. And so the whole idea, with supported decision-making, we have now about 40 different videos of people talking about how they make decisions. And through Life Course Online, they can actually go in and say, here's decisions, like in the health area. You can say, here's things I can decide on my own. Here's some I need a little bit of help. And here's somebody needs to make decisions for me. Because that's their right.
And John, that's not any different than any of the rest of us.
Exactly.
Who wouldn't go to someone else if you're diagnosed with cancer or whatever, and talk to people and say, hey, let's talk through this with me. Let's help me figure this out. Or what have your experiences been, and so on and so forth. We all need support. It's just different levels at different times for different things.
Well, the other thing we've learned, Craig, which is so interesting, is that as we look at the issue of staff turnover, and we heard about the need for higher wages, which is absolutely true, we also have to think about the well-being of our staff. How are we thinking about them as individuals? One of our self-advocates recorded a video for us, and he said, people expect my staff to be caring, creative, and helping me build my good life. Again, this is a man who supposedly has an intellectual disability.
I'm getting ready for some wisdom here.
He turned it around and said, who's helping them build their good life?
Wow.
Who is looking at them saying, well, you got through high school. What are you going to do beyond that? What is your goal in life? Where do you want to be? What is it you dream about? And he said, why aren't we doing this together? That you're supporting me and I'm going to support you. And he told me a story. He said that this guy he works with has always wanted to be a country western singer. And so Jason said, okay, I want to go see you sing somewhere. And he said, really? Why? Well, I'm going to support you in your goal.
How nice is that?
Yeah. So how did we find, and it led to, I told this story to another home that we work with, and the three women in the home said, well, that's very cool. And it starts with one of our videos saying, asking each other, if we're working together, saying, what brings you joy?
Yeah.
And the lady that one of the staff said, happened to be an African-American woman, she said, the thing that brings me the most joy is singing in my church choir. And the three ladies in the home said, we want to come see you sing.
How nice.
And she first cautioned and said, well, this isn't like your white folks' church. We're not done in an hour. We may go 3 hours. And they said, that's okay. The three of them end up going to church. Now, there are only 3 white faces in the church, but they loved it. One of those now is singing in the choir.
Wow.
The other 2 decided, well, it's a little too long. It's not for them.
Yeah.
But that's
okay. That's right.
The idea that we're going to support you because we know what brings you joy. So we talk to staff so much about compliance, record keeping, and things they have to do. How do we make their lives whole? And how do we begin thinking about it?
And you talk about staff retention. You have that type of investment in your staff. They're going to want to stay.
Absolutely.
And work for you.
We put out a publication through our Quillo for our, it's for anybody, but we did it for our users. And it was for agencies. And, this is a tough time financially for people. Even with the staff raises, inflation's going up. And it was 17 ideas, we call it down to the penny, of what agencies are helping people on their staff to get through a tough time. And creative things about, if you've been there 6 months, you can get an advance on a paycheck and pay it off over the next year. Other agents, one agency, Trinity Services in Illinois, that they call it the Cookie Jar Fund. And if you call into HR by 10 o'clock in the morning, you get $300 cash by 3 o'clock in the afternoon. Not a loan, but it's going to go on your W-2. You can do it once a year.
Wow.
And it's whatever emergency you're dealing with
an emergency.
And you don't have to explain it. You don't go in and say, Craig, I got my lights turned off or my car broke.
You just say, hey,
I need to tap the Cookie Jar Fund.
This is mine.
And the CFO told me, he said, I thought they have nearly 1,000 employees. And he said, I thought this is going to be bankrupting us. And about 35% of their people used it.
Yeah.
But the CEO told me you got the nicest notes from people that,
I'm sure.
This let me get presents for kids at Christmas, and we got the car fixed. And, it is just as an example of how do you extend that person-centeredness that we do for people with disabilities to our own staff.
Where can people find that document?
They go to our website. Again, leave me a note, and I'll just send it out to you and get it to you on there. So,
excellent.
Friends for Life Residential Care, specializing in support for individuals with developmental disabilities, offers services like adult day support and home health care. Emphasizing empowerment and quality of life, we live by the motto, my ability is stronger than my disability. We are currently hiring, welcoming those passionate about making a difference. Learn more and explore career opportunities at friendsforliferc.com.
I'm Dr. Craig Escudé, President of Intellectability. State developmental disability agencies, managed care organizations, and providers across the United States use Intellectability's health risk screening tool, e-learn courses, and person-centered training to improve health equity for people with IDD. Visit replacingrisks.com to learn more about how you can employ these tools with people you support.
So John, one of the things I like to do is ask guests to tell us 3 things in 3 minutes. I call it 3 and 3. Words of wisdom, tips, words of advice to listeners to help that you think can help improve the world of supports and services or health and wellness or anything related to people with intellectual and developmental disabilities. So do you have 3 things for us?
Great question. First one, 2 people that really influenced me. One is Marty Seligman on the positive psychology, that it's our role to project positive energy to folks and look at the positive in the world around you. And the best way I can explain that is the poet Mary Oliver, where very short poem, and she first talks about be present. Don't live in the past. Don't worry about the future. Be present. Look around you and be prepared to be amazed. And then tell others about it. You know, we are caught up in this beautiful negative emotions right now. And whether you talk politics or the economy, we're at each other's throats, it seems like. We all need to take responsibility, and this is what we try to live through Quillo, to build a culture based on joy, that there are things that we can do by seeing something amazing, by being present. You know, because if all you're thinking about is worrying about tomorrow or regretting yesterday, you miss the beauty in the world around you. Then secondly, just be open to that, being amazed that if I'm present learning about this, and then look at what this young woman that spoke today as CEO of the Oregon Self-Advocacy Coalition, who herself, and she talked about, introduced herself, how she experienced having an intellectual disability herself. And she did a wonderful presentation today. And that was really kind of amazing, is how they're building that coalition. And then we all have a responsibility to tell people about the positive things that are going on. Because it's really easy to get trapped into just the negatives and all the problems we have to solve. And I think that's where be present, be amazed, and tell others about it.
That's fantastic. Wonderful words of advice. John, I love your positivity, your passion for the work that you do. Thank you so much for taking the time to talk with me today and share your experiences and the work that you're doing. But more importantly, thank you so much for the incredible work that you have done and that you continue to do.
Well, thanks, Craig. And, you know, you just know that from my heart that there are people alive today. People are alive today because of the work you do and the change you're making that started with Karen, and we talked about this earlier, that they're alive today because of the tools and the attitude you're bringing that is, you'll never meet them. You will never meet them, but they're alive today and functioning and have a life because of the work you're doing. So thank you. It's an honor to be with you today.
That is very kind, and I don't have much to say after that. So thank you, John.
Okay.